Okay, let's dive right into this. Health insurance can, honestly, feel like a giant maze of jargon, fine print, and confusing regulations, right? It's the kind of thing that makes you want to just throw your laptop right out the window. But actually, understanding your coverage doesn't have to be a massive headache. Welcome to today's Explainer, where we are going to completely decode the Affordable Care Act, or the ACA. We're going to break down exactly what protections you're guaranteed by law, how to spot the hidden financial perks, and most importantly, how to make absolutely sure you are in the perfect plan for your specific needs.
It's the million-dollar question, isn't it? What exactly does an ACA plan cover? Whether you call it the Affordable Care Act, Obamacare, or marketplace insurance, they're all talking about the same thing. And there are strict, legally binding rules about what these health insurance plans must provide. We're going to demystify these rules today so you know exactly what you're paying for, and more importantly, what you should be getting in return.
So, here is our roadmap for today. We're going to cover the essential health benefits, free preventative care services, pre-existing condition protections, understanding your plan details, and finally, how to get some much-needed expert insurance help.
All right, Section 1, the essential health benefits, the baseline guarantees. Under the ACA, all marketplace plans, and honestly most private health insurance plans too, are legally required to cover 10 core services. Right out of the gate, plans must cover pre-existing conditions. That is massive, and we'll definitely dive deeper into that in just a bit. They also have to cover preventive and wellness services, along with chronic disease management. So we're talking about managing things like diabetes and hypertension. They guarantee coverage for ambulatory patient services, which, is just a very fancy industry term for standard outpatient care, like going to see your doctor. Plus, you're covered for emergency services, meaning ER visits and ambulances, as well as inpatient hospitalization and surgeries. The sheer scope of this coverage is actually pretty impressive. Just look at the rest of this list. Maternity and newborn care, including labor and delivery, are totally guaranteed. So are mental health and substance use disorder services, meaning behavioral counseling and therapy are covered. You also get coverage for prescription drugs, both generic and brand name. Rehabilitative and habilitative services are included too, to help you regain skills if you've had an illness or an injury. And finally, pediatric services. This one is crucial because it specifically includes oral and vision care for kids, along with standard laboratory tests. Every single ACA-compliant plan must include these core categories. Moving right along to Section 2, free preventative care services, zero-cost care before your deductible. This is hands down one of the absolute biggest financial perks of the ACA. But you might be wondering, what actually triggers it? Well, our sources define preventative services as routine healthcare that includes screenings, checkups, and patient counseling to prevent illnesses, disease, or other health problems. The absolute keyword here is routine. Think of it like getting the oil changed in your car. This is about catching things early and maintaining your health, not treating a brand new, sudden illness. Now, there is a huge financial contrast here that we need to clear up. We just talked about the essential health benefits. Those are covered, yes, but you still have to pay your share, meaning they are completely subject to your deductibles, your copays, or your coinsurance. Preventive care, though, totally different ballgame. For specific preventive services, you pay absolutely no copayment or coinsurance, even if you haven't met a single dime of your yearly deductible. It literally costs you exactly $0 out of pocket. So what's actually included in this free adult routine maintenance? It's a pretty extensive list. It covers blood pressure and cholesterol screenings if you're at risk. It covers critical cancer screenings like colorectal screenings for adults 45 to 75 and lung cancer screenings for high-risk individuals, which, let's be real, without insurance could normally run you thousands of dollars out of pocket. A huge array of immunizations are also totally free. The flu shot, tetanus, shingles, measles, you name it. It even includes depression screenings and screenings for infectious diseases like HIV and hepatitis B and C. Now, there are also some incredibly robust, specific zero-cost protections designed specifically for women's health. This includes crucial maternal care like breastfeeding support, counseling, and folic acid supplements. It covers breast cancer mammography screenings and cervical cancer pap smears. It also includes FDA-approved contraceptive methods, provided your plan isn't sponsored by an exempt religious employer, of course. Pregnant women specifically receive screenings for gestational diabetes, maternal depression, and preeclampsia, which just ensures both mom and baby are protected financially from day one. And of course, pediatric preventative services are there to ensure kids get a healthy start in life without adding some massive financial burden to families. Free newborn screenings include blood, hearing, and bilirubin tests. Kids also get free developmental and autism screenings right at 18 and 24 months. Standard childhood immunizations are fully covered, alongside vision screenings, oral health risk assessments, and behavioral and depression assessments as they grow up into adolescence. Section 3. Pre-existing condition protections, the ultimate safety net. If you take away just one single thing from this whole explainer today, let it be this, because this right here is the ultimate safety net of the modern healthcare system. First, let's just make sure we're completely clear on the terminology. A pre-existing condition is simply any health problem you already had before the date that your new health coverage starts. This could be something super common like asthma, a chronic condition like diabetes, or a severe illness like cancer. The crucial, legally binding point straight from Appendix B of the ACA rules is this: no insurance plan can reject you, charge you more, or refuse to pay for essential health benefits for any condition you had before your coverage started. Period. End of story. Once you are enrolled, the insurance company cannot deny you coverage or suddenly hike up your rates just because of your health status. And yes, this strict protection absolutely extends to pregnancy. If you are pregnant when you apply, a plan cannot reject you or charge you more. Your pregnancy and childbirth are covered from the very first day your plan starts. Furthermore, experiencing a birth or an adoption qualifies you for what's called a special enrollment period. This is huge because it means you can actually enroll in or change your plan completely outside the normal annual window. And get this, that coverage can be backdated to start right on the date of birth or adoption, even if you enroll up to 60 days afterward. All right, Section 4, understanding your plan details, navigating the nuance. So, here is where we have to pivot a little bit. While those essential benefits and preventative services are legally guaranteed across all ACA-compliant plans, the specific, nitty-gritty details are going to vary wildly from plan to plan. We're talking about huge differences in your deductibles, your copayments, and honestly, most importantly, your network of doctors and hospitals. Because picking the wrong specific plan, even one with all the legal protections we just talked about, can still cost you an absolute fortune if your preferred doctor turns out to be out of network. To avoid that nightmare, you really need to follow these 3 steps. Step 1, locate the plan's Summary of Benefits and Coverage, or the SBC. This is basically the master document for any plan you're considering. Step 2, dig into that SBC and review the specific deductibles, which is what you pay before insurance even kicks in, and the copayments. Step 3, analyze the total potential out-of-pocket expenses to ensure they actually fit your real-world budget if a worst-case medical scenario occurs. I know, it's a lot of tedious paperwork and homework to get right. Which brings us to Section 5, Get Expert Insurance Help, your trusted guide. Let's be totally real for a second. Reading through dozens of complex benefit documents isn't just tedious, it's incredibly confusing. And this is exactly why you need a licensed expert to step in and do the heavy lifting for you. I highly recommend contacting Eric Burns. He is a licensed insurance agent with deep expertise in ACA plans, and he's licensed to help folks across 10 different states: Alabama, Florida, Georgia, Mississippi, North Carolina, Ohio, South Carolina, Tennessee, Texas, and Virginia. Instead of you guessing which plan covers your specific doctors or offers the best deductible for your budget, Eric can find the exact match for you. You can reach him directly at 678-404-9230 or just shoot an email over to eric@ericburnsinsurance.com. Honestly, taking this one step is how you turn health insurance from a massive point of stress into a real tool of protection. So, I want to leave you with this final provocative thought. You now know that you have powerful, guaranteed rights in free preventative benefits under the ACA, but are you absolutely sure that you are in the exact plan that maximizes those benefits for your specific budget and your local area? Don't leave money on the table, and for sure don't risk being in the wrong network. Reach out to Eric Burns today to get the clarity you deserve. Thanks so much for joining me on this explainer, and here's to making informed, completely confident healthcare choices.